No. I'm like really nervous you're gonna floss out my filling with that floss. No. Or even worse, pop out my crown when you're cleaning my teeth. Hi, my name is Whitney and I'm a dental hygienist here to say no! Your filling or crown, neither of them are going to be pulled out by your dentist and or dental hygienist during your teeth cleaning. That's not something that accidentally happens. It's actually very difficult to remove a healthy dental restoration. By the way, restorations are fillings, crowns, bridges, etc. They are really hard to remove because they are cemented or bonded into place. They don't just pop off if they are healthy. The only way this would ever happen is if the filling or crown was already in bad shape. Like it's a defective filling or a defective crown. Something's wrong with it. It's loose, it's infected, it's cracked, or it's decaying, it's old and it's falling apart. Whatever the case. If it's already on its way out and it just so happens that it comes out during your dental cleaning appointment, please know that it's not because your dentist or your dental hygienist did something wrong. It's not because of the cleaning appointment itself. It's because it's defective and it would have just as easily come out at home when you're eating or flossing. And if it does happen at the dentist, it's usually because the patient has been avoiding that tooth at home, unfortunately, maybe because it feels loose, they know it's on its way out, or they simply just don't floss, so they didn't know. Or they don't floss on purpose, or they purposely don't chew on it simply because they're just worried about pulling it out, even though it's never felt loose or anything. Especially with bridges, lots of people don't floss under them because they're afraid that the floss will pull it loose. But the thing is, it's the opposite. If you have a healthy restoration, not cleaning it, not touching it is what will actually make your restoration fall out or come out over time. Because avoiding flossing around your crowns and bridges and fillings, all that is going to do is set you up for recurring decay around the edges, cavities around the edges from not cleaning it. And when that happens, the entire restoration often fails. So if you've been avoiding a tooth at home and now when you're at the dentist you want us to avoid it too, no, that's not helping anything. That's just making things worse. If you want your dentist or dental hygienist to skip that area that you're worried about, that's just allowing more bacteria to enter that area and it's literally setting up yourself for failure. You're just prolonging the issue. So there was a recent comment on one of my videos that really inspired me to make this video. It said, I had a filling and when the dentist cleaned it, she said that it popped out. I have an appointment coming up next month and I don't know how to tell her not to do it again. Any advice would be appreciated. And when I was reading this, I realized that patients passively say this to me all the time at work. No. I'm like really nervous you're gonna floss out my filling with that floss. So you know now that that's not a thing. Dentists and dental hygienists can't just pull off a healthy restoration. And so going back to that comment, there's no advice to be given to your dentist. It's the opposite. There's advice to be given to the patient, and that's to make sure that you're cleaning your restorations properly every day at home. Because the more you clean your crowns and fillings at home, the less likely they will become defective and the less likely they are to fall out, whether that's at the dental office or at home. And honestly, I mean, if it does fall out at the dentist, that's actually the best place for it to fall out because then it can get fixed right away. So how are you supposed to clean around fillings and crowns at home? To properly clean restorations at home, it's pretty much the same as your regular teeth. Be sure to brush at least twice each day. Make sure the bristles are angled toward the gum line so that you can remove the plaque around the edges. Also be sure to floss at least once each day. You need to physically clean between each tooth, each crown, and or filling and or bridge. And flossing is the only way to do that. Water flossing is a great option as well if regular floss is difficult for you. Definitely try a water flosser. Floss picks, however, are usually discouraged around restorations just because they generally don't clean as well. And if they get stuck around a crown, they are really hard to get out. Speaking of, if your regular floss ever gets stuck around a crown, be sure to pull the floss out between the teeth from the side instead of up and out. It helps a lot. So in all, don't make the mistake of not flossing your dental crown or filling or bridge just because you're worried you might pull it off. It's 100% more likely that not flossing, not touching it, not cleaning it, that will lead to it popping off. And I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you want more teeth talk, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram at teethtalkgirl. Peace, love, and teeth